Hello students, today we will talk about drugs acting on autonomic nervous system. So welcome to Ban Lectures. Now what are autonomic drugs? Autonomic drugs means those very drugs which act on autonomic nervous system. Now, autonomic nervous system is divided into two basic divisions. One is sympathetic division, other one is parasympathetic division. This division is being made on the basis of anatomy, on the basis of physiology, and on the basis of presence of neurotransmitters. Now, drugs acting on sympathetic division are known as sympathomimetic agents, adrenergic agents, or adrenoceptive agents. Similarly, drugs acting on parasympathetic division are known as parasympathomimetic drugs, cholinergic drugs, or cholineceptive drugs. Now, classification of sympathomimetic drugs. So, this is possible on the basis of chemical structure. You can call it chemical classification. On the basis of pharmacology, that is pharmacological action or mechanism of action, you may call it pharmacological classification. Thirdly, on the basis of therapeutic use, we can call it clinical classification also. Now, classification of sympathomimetic drugs on the basis of chemical structure. This is being done on the presence of catechol nucleus. If catechol nucleus is present, then these very agents are called catecholamines. Otherwise, if catechol nucleus is not present, they are called non-catecholamines. So, on the basis of chemistry, we have sympathomimetic drugs into two broad classes, catecholamines and non-catecholamines. Catecholamines mean they bear a catechol nucleus. Non-catecholamines mean they do not have a catechol nucleus. Now, catecholamines include naturally occurring catecholamines or endogenous catecholamines such as adrenaline, noradrenaline, and dopamine. And we have synthetic catecholamines means isoprenaline, dobutamine, dopisamine. Now, non-catecholamines, as we said, means absence of catechol nucleus that includes ephedrine, amphetamine, and a number of derivatives of amphetamine. This is basically catechol nucleus. You have a benzene ring and two OH groups are present at 3,4 position or ortho position. We may call it ortho dihydroxybenzene. If this type of structure is present, then we will call it catecholamines. So catecholamines means adrenaline, noradrenaline or dopamine. They do bear this type of nucleus. Simple. And non-catecholamines, ephedrine, amphetamine and other agents, they do not bear this type of nucleus. So we call them non-catecholamines. Now, classification of sympathomimetic drugs on basis of mechanism of action, that is pharmacological classification. Now we have directly acting sympathomimetic agent. Directly acting means they will directly interact with the adrenergic receptors. Adrenergic receptors are of two types, alpha and beta. So if they interact with alpha receptors or beta receptors directly produce the desired action, we will call them directly acting agents. So these are further subdivided into selective agents, directly acting agents, but they are selective in their action, selective with respect to receptor. So their selectivity lies with respect to receptor. If they are alpha 1 selective, they interact with only alpha 1 receptor. Alpha 1 is the subtype of alpha receptors. So alpha receptor has two type of subtypes, alpha 1, alpha 2. Similarly, beta receptors has different subtypes. We have beta 1, we have beta 2, we have beta 3. Now, alpha 1 selective includes phenylephrine, methoxamine. Alpha 2 selective includes clonidipine, apraglutide. Beta 1 selective includes dobutamine. Beta 2 selective includes salbutamol, salmeterol. Beta 3 selective, they are under investigation. Now, indirectly acting sympathomimetic action indirectly means they will not interact with the adrenergic receptor, whether alpha or beta directly, but ultimately they will help in release of noradrenaline or adrenaline, which is the neurotransmitter of sympathomimetic system. So, example is tyramine. Then we have another subclass here, that is those sympathomimetics which have both direct as well as indirect action depending upon the dose. We call them mixed action. For example, amphetamine, dexamphetamine, methamphetamine, these are various derivatives of amphetamine, and ephedrine. They have both type of indirect and direct action. That is, they have a mixed action. Now we can classify sympathomimetic agents on the basis of therapeutic use. We may call it clinical classification. Some of the sympathomimetic agents, they are used as bronchodilators, especially in bronchial asthma. That includes short-acting agents and long-acting agents. Short-acting agent means salbutamol, terbutaline, tretodine, isoxaprine. Long-acting ones include salmeterol, bambuterol, formoterol, aformoterol, carmoterol, indicatorol, etc. Then CNS stimulants, which stimulate central nervous system like ephedrine, amphetamine, modafinil, armodafinil. Nasal decongestants, that includes alpha-2 agonists such as oxymetazoline, xylometazoline, nefazoline, even ephedrine, and to some extent pseudoephedrine. Then some sympathomimetic which are used in allergic manifestations, especially in anaphylactic shock. Adrenaline is the example. This is the drug of choice in anaphylactic shock. Then some sympathomimetic which have a ocular use, which help in dilatation of this eye, dilatation of pupil. For example, phenylphrine. Appetite suppressants, also known as anorectic agents, amphetamine group of drugs. Then attention deficit hyperkinetic disorders. This is a disorder found in children. Here we also make use of certain sympathomimetics like methylphenidate, atomoxetinil, moxetine, lisdexamphetamine. Then we have cardiac stimulants. For example, during congestive heart failure, sometimes adrenaline is used, isoprenoline can be used, dobutamine can be used. Now, some sympathomimetics which are combined with local anesthetics to enhance the duration of action, like adrenaline or phenylphrine. Uterine stimulants used in labor, salbutamol, terbutaline, ritodrine. Then certain prasar agents like noradrenaline and dobutamine. Now let us summarize it. Adrenaline is no doubt a sympathomimetic agent. It can act on alpha 1 receptor, alpha 2 receptor, beta 1 receptor, beta 2 receptor. So it is non-selective in its action. Similarly, noradrenaline can act on alpha 1, it can act on alpha 2, it can act on beta 1 receptors, but no, doesn't act on beta 2 receptor, and again it is non-selective. Dopamine can act on dopamine receptor D1, dopamine receptor D2, some on alpha 1 receptor as well as beta 1, again it is non-selective. Similarly, isoprenoline can act on beta 1 receptor, beta 2 receptor, beta 3 receptor, so it is non-selective in its action. Now, prenalterol is completely beta 1 selective, can act on beta 1 subtype of beta receptors. Similarly, we have clonidine which and alpha methyl dopa, they are alpha 2 selective in their action. Now salbutamol, terbutaline, formoterol, they have a selective beta 2 action. Phenoldopam is completely dopamine selective, D1 selective. Thank you.